Sometimes when family and friends can't gather in person for the holidays, for whatever reason, talking on the telephone becomes the next best thing. However, what if someone can't use a standard phone due to hearing or speech impairments? There is help available, and here to tell us about it is Danny Broxson with the Center for Independent Living Disability Resource Center. It's a mouthful, but thanks for being here.
Thank you for having me.
Well, I know y'all do lots of things at the center, so tell us a little bit about what y'all do at the Center for Independent Living and Disability Resource Center.
Okay, we have 4 core services that we provide. We do information and referral. We do peer counseling, which is one person with a disability talking to another person with a disability. We do advocacy, both systems and individual, helping them to understand their rights and advocate for themselves, making changes to public policy, buildings, different things like that. We also do skills training. If somebody needs to learn a particular skill to maintain their independence or in their own home, we can help them with that. And we also do a large loan locker of durable medical equipment. So if somebody needs a walker or a wheelchair or crutches or something like that, we can assist them with that.
We get a lot of calls, and we're always referring people to y'all for that. But for all of your programs, are they more? Where do your referrals come from? Are these people who individually seek y'all out, or is this someone who's recommended to y'all, you know, their doctor, their social worker,
right,
someone says, here's a resource for you?
It's probably a little of both. Sometimes I think we're the best kept secret in Northwest Florida. A lot of people that come to us say, well, we didn't even know you were here. My doctor referred me, a social worker, somebody like that. Mm-hmm. And so they come to us in all different ways.
Well, you've got a great website and there's lots of information. So I think people can just Google the Center for Independent Living in Northwest Florida, correct?
Absolutely.
Okay, great. Well, let's get into one of the programs. We're talking about the holidays and depending on the phone in some cases and maybe not being able to use a standard phone. Really, what does that communication add to the holidays, do you think, personally, being able to use whichever system is the one that's finally decided upon?
It's really huge because a lot of what we see are people, of course, that are hearing impaired or deaf, and a lot of times they feel isolated and they're alone, and they can't communicate with their family because they can't talk on the telephone. So they come to us, and we're able to provide them with an amplified telephone or information about the relay service where they can finally get to talk to their family. You know, a lot of grandparents want to talk to their grandkids, sure, especially during the season, and it's just huge. It's nice when you see somebody come in and they don't really know what they want, don't really know what they need, and we sit them down and talk about those things and show them what we have, and then when they leave, sometimes they cry, sometimes they're just really happy that there's a service out there, there's equipment out there for them to be more independent and to...
That communication is just opened back up for them.
It's opened back up. It's huge.
Well, you've done a great job of educating me about a lot of these things. And so from what I understand, there's the Florida Relay Service, and then there's amplified phones, which we have one here, and we'll talk more in depth on the amplified phones. But just briefly, what is the Florida Relay Service?
The Florida Relay Service is the communication link that connects people who have a hearing loss or may be deaf to those who use standard telephones or don't have a hearing loss. So basically you call 711, talk to an operator, give them the phone number that you want to dial, they communicate with the person who is deaf and relay that information back to you as they communicate.
So it's kind of like a third party kind of facilitating the conversation.
Yes, sir, a third party, but they're very helpful. Mm-hmm. They're very trained to deal with different levels of hearing loss, different disabilities, and also to only communicate what is being said.
So the person with the hearing difficulty is typing a message that's being read by the relay person and then verbally
communicated back to the person who can hear. So it allows them to talk back and forth until the conversation is over.
Great, great. Well, now, then the amplified phones, I know y'all do a lot of that here, and we have, thank you for bringing one. I mean, really, it looks pretty much like a standard phone. I see a large volume button, and of course, the larger size numbers as well, but this is certainly not anything bulky or hard looking to use. I know there's one of several models that you have, but tell us a little bit about the amplified phone service and how you determine if this is a good fit for someone.
Well, the great thing about this program is that not one size fits all. If somebody needs a different amplification, we have those phones. We have different types of phones for different hearing losses and deafness and different things. So we can bring the person in, let them use the phone, practice what's going on, and use the phone and see what works for them. Because not all of it, sometimes we may recommend and say, well, what about this? And if it doesn't work, then we can try something else. This is our cordless model, but we also have the desktop telephone, the CapTels, which is the reading and different phones.
So you say CapTel, it's like it actually the message is spelled across the screen.
It scrolls
of some
across
sort.
the screen and you can read it. We also have the video phone that you can actually see somebody, and that's a nice phone. But
well, and I think when you said best kept secret, I think the best kept secret is there's no charge for this, right?
There is no charge for that, either for the relay or for the FTRI, Florida Telecommunications Service. Because you've been paying an 11-cent tax on your phone bill since 1991, which allows FTRI to provide those services.
So if someone thinks that this is something that they need, or maybe a family member wants to recommend it to another family member, what's the process for for applying or the criteria for receiving one of these?
It's a simple criteria. If you don't fit one, you might fit the other. Basically, you have to be a Florida resident, a permanent resident of Florida, over the age of 3, have a hearing loss. You can either be referred to us by an audiologist, but if you're just coming in off the street, think you might need a phone, there's a 5-minute hearing test that we can provide, and we can certify you at the CIL, and then you can leave with the phone. So it's not a huge process. And in that process, like I said, we can try different phones, do different things, and make sure that you're satisfied with what you're getting before you leave.
Do people sometimes see that, like you say, that it's not a one-size-fits-all, and so maybe they will try out several, or do they try them all in your office?
We've had people bring them back and say, well, I'd like to try something else, or different things. So we're very patient. We can work with them and try and do different things and make sure that they're satisfied. That's the main thing, is to make sure that they have what they need and that they can hear on the telephone and are able to communicate. So,
well, that's great. And before we go, is there any kind of advice you would recommend to someone who really is a little uncomfortable talking on the phone, maybe is trying to cover a little bit, and they know the holidays is coming up? What's this going to provide them with?
Well, it's really going to allow you the freedom to communicate and to do the things that you want to do, talk to the people that you want to talk to, and do just be a part of, get involved again if you choose to. It's important that people are able to communicate, that they don't feel that sense of isolation, especially during the holidays. I think I was telling you before we started, a lot of our clients are elderly and they want to talk to their grandkids and have that relationship. And a lot of times the only way to do that is by phone. So it's very important. So.
Perfect. I agree with everything you're saying. It's just a great opportunity. Socialization is so important, as we see at the Council on Aging with the elderly. So thank you for coming and talking about this program, and we'll have you back to talk about some of the other programs here soon.
Thank you.